So I arrived safely in Vegas, and I'm getting the final touches on my talk ready for Friday, where we will do the art and the science of the harvest, meaning the bone marrow aspirate technique that is designed to get you the highest yield of CFU-Fs, which are a surrogate for MSCs, stem cells, and hopefully the results in a dose response curve. And we'll also talk about the patient comfort. But I had to stop and answer a question that came through on the presentation from this weekend. On Saturday, I gave a case presentation and I told about a 49-year-old woman who had axial low back pain. She had fissures in 2 of her lumbar discs. She had pain that was radiating mostly down into her buttocks, nothing down into the legs. Despite having tiny little bulges, this was not a radiculopathy, but she did have some facet joint changes. She had some spondylolisthesis, a little bit from flexion extension of 2 millimeters, which wasn't crazy, but I got those FlexX films because she was a former gymnast, and I wanted to make sure that we didn't have a PARS issue. She did not. So prior to, and here's where the question came in, prior to treating her functional spinal unit, which ended up being the discs, the epidural space, the facet joints above the levels of and the levels below, the sacroiliac joints, think buttock pain, and all the overlying ligaments and muscles, why first did I do something crazy according to this person who wrote me? I got her hormone levels. I got her vitamin D levels, her CBC. I wanted to know her renal and hepatic function. I wanted to know her A1C and her general inflammatory markers. Why? She was menopausal. She was hurting everywhere. She'd gained some weight. She was in an inflammatory situation. And if we didn't correct her estrogen first and get that bone strength, muscle strength, decreased risk of sarcopenia, decreased risk of chronic pain, decreased risk of frozen shoulder, decreased risk of osteoporosis, then we weren't going to do anything with her own cells. So that was part of it, along with optimizing her low vitamin D, because that's responsible for bone and teeth and neuromuscular function as well as mood. So all these things were optimized. That's what I wish that my talk on Friday could be about, is pre-procedure optimization and talking about if we're going to take inflamed bodies and put them through these processes, then we're not going to get the results we want.